Hello, everyone, and welcome to a very special edition of Your Life, A to Z. Today, we really want to try and educate when it comes to that emergency and prepare you as best as we can by arming you with some critical information. Joining me today is my co-host. He's Dr. John Shufeldt, an ER doctor who's spent a lot of time dealing with emergencies. And this is going to be an interesting show because we are really going to get informational here.
We're going to have fun. We are absolutely covering the gamut of emergency service, everything from the fire trucks behind us, you saw in the opening, some rescue helicopters. We'll be looking at kind of a day in the life of the emergency medicine.
In fact, we actually followed you, Dr. John, because you do ER at St. Joseph's Hospital.
Correct. About 100 million people a year visit emergency departments every year. Some
amazing.
For very appropriate reasons, some for reasons that may be a little inappropriate. So why don't we look at what it's like for a day in the life of the emergency medicine.
All right.
Who are you fighting? Some guy you were working with?
Actually, we're working at terminal number 4.
Oh, at the airport?
Yeah, at the S2 concourse.
Yeah. You guys are betting on when the planes are coming in?
No, actually, everybody's out in the confined area.
Yeah.
And all the workspace getting pretty good.
Tight.
Yeah,
Is it?
Everybody's just getting on each other's nerves. And this guy came in with an attitude this morning.
Oh, really?
Yeah.
You had to whack him? Kick your feet up here. Let's take a look at you. Tilt your head back. Are you pretty healthy otherwise?
Yeah.
Any medical problems at all? Yeah, you definitely have a scratch there. And look way down. There you go, good. I'm going to put a couple of drops of stain in your eye, and that's going to see if, we'll look at what's called a Wood's lamp, and you'll see if you have a little scratch. It looks like you kind of do. Your conjunctiva is the white part of your eye right there, and it's pretty red and bloodshot. And I would bet somebody got a fingernail in there and scratched your eye, but we're going to look at that in your cornea. Things to watch for, any redness or junk leaking out of your eye, like it turns, green stuff coming out of your eye, you want to come on back. I don't think you're going to have any further problems with your vision at all.
Okay.
So, okay.
Thanks a lot.
All right, such hold on. Take care. Give me about 5 minutes, we'll get your paperwork done. So what happened to you? You started punching the windows? Someone was going to shoot you? But then I heard you tried to get in the fire truck and drive away.
Yeah.
Were you taking anything? Were you doing any drugs?
Unfortunately, yeah.
Yeah, okay, all right. Well, we can chat about that later. Hey, can I grab a pair of gloves there?
Yeah.
How many windows did you punch out? Thanks. Sorry? A few? We'll just check her labs out here and see what she was on. All right. Her blood count looks good. Her plate look good. Her drug screen's positive for cocaine. A little bit of alcohol. And cocaine and alcohol are a bad combination because the byproduct is something called cocaethylene, which is a lot more toxic than just plain old cocaine or plain old crack. It has a lot more cardiac side effects than just the cocaine alone. So we got an EKG on her, which we'll have to track down. And we'll do a right hand x-ray. And there's no glass in here, which is kind of where we think we should have it. And the bones look good. And the last view is kind of the oblique view. And again, no foreign body. Cool. Okie dokie. Hello. How you doing? Dr. Shufeldt. What's going on there, buddy?
You know, it's really amazing, John, how many patients you have to treat in each day. When I watched some of the footage, I just thought, how do you keep up with it? How many people are you talking about a day?
You know, most emergency physicians see about 20 to 50 a day, and it really depends on what the acuity is when the patients come in at St. Joe's. It's kind of what zone you're in. There's a zone 1, 2, and 3, and it's kind of zone 1's the real acute zone, and kind of goes down from there. So it really is variable.
Well, it's really interesting because, of course, everyone watches the show ER, and there's always a disaster and a catastrophe. That's not the way real life is in ER every day, right?
Well, I think for the people who are having it, it's definitely a disaster to them or a tragedy to them. It's not always the bus accident out in front of the hospital when everything shuts down, but there's a lot of disasters that happen every day that, you know, Phoenix Fire addresses, and nobody really ever hears about it because it's not the true disaster that people think. People are so conditioned now to what a disaster is. You know, 5, 10 people in a car accident is kind of like a yawn.
Right. Yeah, it's all the big cop shows that we've been watching on television. It's kind of changed things a little bit.
Right.
Let's talk about ER, though, and this is so important because so many people panic when there's an emergency, so they immediately go to ER, and so often that could be avoided. What are some of the other options?
Well, you know, there's a book out called House of God, and they always say the first rule in emergency is take your own pulse, and everybody kind of laughs about it, but it's like, you know, the first thing you do is kind of calm down and really survey the situation. A lot of things that people think are emergencies, if they would just step back and try to look at a bit logically, may not actually be an emergency. So calling your own physician oftentimes is great. If it is an emergency, you typically kind of know it. It's people having a hard time breathing, they're bleeding, and you can't control, and that's what 911's for.
Yeah, I was going to say 911, can you go ahead and call and walk through a crisis rather than going into ER? Would that be a step before going to ER?
Well, 911 will definitely stay in the line with you and at least get you probably calmed down and have the ability to talk through it. Once Phoenix Fire gets there, for example, a lot of times they'll see patients and say, okay, kind of here's the deal. They check them out very thoroughly. They call in sometimes, but usually it's all very protocol based, and if it's an emergency, they'll bring in, and if it's not, they'll kind of work through it with you.
What about just your basic emergency? Okay, you don't want to go to ER. What about the urgent care facility? I know you've got the Next Care Urgy Center concept.
Right. There's a lot of emergencies. You know, depending on what you read, about 30 to 50% of the people who are in emergency departments are the ones who need to be there. The rest of them probably could be treated at home, at their doctor's office, or in an urgent care center. And
let's not forget those long lines at ER. I mean, don't you have to be patient a little bit when you go to ER? I mean, obviously, if you're in a crisis situation, but if it's not so bad, I mean, that's the big complaint. The ER lines are so long.
Right. People in emergencies get triaged, and you're triaged based upon your acuity. And if you're very ill when you come in, you get seen right away, and no one ever has a complaint with that. If you're not as ill, if you have something that can wait a little bit, you may wait, and sometimes you wait a couple hours before you're seen.
Worst emergency you've ever seen in your time at St. Joe's?
Wow, I mean, I try to forget try to forget a lot of them, so there's enough that.
I know drownings are tough a lot of the time.
Right. Kid drownings are probably the worst. Kid burns are the worst.
Okay. Well, we've got our whole show devoted to ER. In fact, behind us, we've got some really cool vehicles here. And you're going to give us a tour in a little while with Bob Kahn from Phoenix Fire. They do such a terrific job.
They do.
Inside the ambulance, inside the guts of it. I've always wondered, how do you do medicine on wheels and in the middle of crisis and panic, keep your cool?
Well, I don't do the medicine on wheels, thank God. That's why they're the experts in that.
Okay. We're going to. And what are you going to? Yeah, right. What are you going to be doing today? I know you've got some very interesting gear. We're talking like technology and stuff like that.
Well, everything from practice suturing arms for residents and
let me see that
students.
arm.
There, have a nice day. And
are you going to teach me how to suture?
Yeah, absolutely.
So nice to know you. Wow.
And some other kind of cool equipment, from automatic defibrillators to non-automatic defibrillators, when you have to actually push the button.
Yeah. Do you think we're going to need defibrillators in the kitchen or something?
Oh, yeah.
Honey, what's wrong? Chest pains? No. Anyway, we're going to do that. Also on our show today, we're going to cover everything from, as we said, technology. We've got Phoenix Fire out here. The big blowout. What do you do? We'll talk about tire safety as well. And poison control.
I don't like rattles. What's this? I don't like spiders or snakes.
Right, and lions and tigers and bears. Actually, we're going to talk about scorpions and snakes and the poison control and those insect bites here in the wild desert. So we're going to do that. But first, we're going to take a break and come back. And Dr. John here will be with Bob Kahn, Phoenix Fire, to give us a tour of the ambulance as we continue your life, our show, ER. Welcome back, everyone, to our special edition of Your Life. This is our ER show, and we're focusing on the emergency and trying to arm you with as much information and knowledge to help you through any kind of crisis. Now, what about the ambulance? There are many chances that you or a loved one could end up in there. Right now, we want to toss over to Dr. John Shufeldt, my co-host today, as well as Bob Kahn with Phoenix Fire, and you guys are taking us inside an ambulance. Gentlemen?
We definitely are, Heidi. I'm sitting back here with Assistant Fire Chief Bob Kahn from Phoenix Fire, who's going to give us a little tour around the ambulance. You know, I always tell the Phoenix Fire crowd that I have it very easy, and what they do on the scene and in the back of an emergency medical vehicle is kind of the tough stuff. So, Bob, welcome.
Thank you, sir. Thank you.
Hey, why don't you show us around here a little bit? I don't get to spend too much time, thankfully, in the back of these things. Why don't you
give you a
show
little
us around?
tour?
You bet.
Yeah, basically what we do is we set up an ER inside the ambulance here. So we have all the essentials you'll need. A 3-lead monitor. We can use this for defibrillation if there's a cardiac patient, if we have a code, something of that nature. We also have oxygen, suction, just like you would in an ER room. And you have somebody at the head of the patient here that can protect the airway. You know how important that is.
Right. That's, the ABCs of life-saving is airway, breathing, and circulation.
One of the things that we use here is we can actually send this message to the ER room, and we can tell the doctor what to expect as we're in transit to an emergency room, and that includes all the Valley hospitals. There's the level ones, the ones with the serious patients typically will have at least 2 people in here working on the patient. We can even do CPR inside here. There's enough working room. Typically, you don't like to see somebody on one of these beds, but if you're in a crisis, a medical crisis, and you need it, we're available. We try and get to those people in about 4 minutes, have about a 12-minute turnaround on scene, and then get them to the hospital.
For a lot of patients with cardiac emergencies, by the time they bring them into the emergency department, the game's already over. In fact, the Phoenix Fire crowd has already saved them or got them to a place where they can be saved. But the initial 3 to 4 minutes is kind of the crucial issue.
It's huge. It's all, well, and you know this, it's all centered around how long your brain can go without oxygen.
Right.
So as soon as we can do that, as soon as we can defib them, especially if people activate the system early, get us there. There's some automatic external defibrillators out in the system. People know in CPR. All those things help us do our job.
Right. It's actually kind of almost funny sometimes when the Phoenix Fire brings a patient in. Everything's really been done. The airway's secure. They've intubated the patient. They're on the monitor. They've had all the rounds of ACLS drugs. And I'm like, hey, I'm ready to discharge this guy because you've done all the work.
Well, they do a good job out there. They're well trained.
They do. So let's go over some of the medications you have in here.
Basically, we have a full complement of medications for either allergic reactions, cardiovascular drugs, seizure drugs, diabetic medications. We carry a full complement of any sort of medical emergency drugs on the truck itself. And then we'll patch. Some of those we have standard operating procedures where protocol where we can go ahead and administer those drugs. Some of those things make a huge difference if you're talking about a diabetic patient or cardiac patient or even possibly a CVA, a stroke patient.
Right.
We can administer those drugs effectively doing the same thing that they would do in an ER room. We patch with the doctor. They know what to expect from us. And as we're transporting that patient, we'll get them on oxygen. That's one of the best things we can actually do is a high-flow oxygen, getting the drugs on board, and then protecting that airway.
Right. You don't use this too much, but even for charcoal for overdoses, for example, just looking through your cupboard here.
Well, we do about 140,000 calls a year. 80% of those are medical.
Right.
So we've had babies born in the back of ambulances.
I had one of those this week.
Did you?
Yeah, well, I did. You guys did.
You can see just about anything that you'll see in an ER room. We start here, and then we'll transfer that patient to the appropriate facility. But we have drug overdoses, car wrecks, 15,000 car wrecks each year with injuries.
Wow.
So we're on the road a lot taking care of patients with medical calls. We'll do 40, 50 burn injuries a year. I mean, you just see a lot of things come through these ambulances that end up in the ER rooms. We do an array of calls, just about anything you can imagine.
Yeah, and I always think, wow, this is a tough deal in the emergency department. Then I always think, wow, it's really a tougher deal in someone's house, bent over their sink or in their bathroom or even worse in a pool.
Well, what we're trying to do is sanitize that call as best we can for the ER room. If we can keep air in them, keep the airway open, work on their breathing, work on their circulation, and get them to the hospital, the physicians there can work miracles. So we're the in-between folks from where it's really critical to getting them into the ambulance and getting them to the ER room as soon as possible.
Well, one kind of funny and tragic patient I had was he got stung multiple times by bees.
Yes.
And he was actually, it was a fatal bee sting way back about 5 years ago in central Phoenix. And these paramedics got out in the middle of the swarm of these killer bees, got the guy in the ambulance, tried to resuscitate him. By the time he was in the emergency department, there were still bees flying out of him, and these paramedics were stung 20 to 30 times a piece.
Yeah.
Amazing group.
The thing those firefighter paramedics do every day are pretty incredible. Most of them you don't even see on the news. They're just out there doing their job. They do a good job.
Well, Heidi, back to you. You've had the nickel tour, the inside of the ambulance, where most of the work takes place.
I've learned a lot. All right, thank you, John, and thank you, Bob Kahn.